Back to the Nutrimedical report for the Friday, 16th of December, and it's literally 9 days to Christmas Day. Hard to believe, and we have, of course, lots of specials on. Be a Nutrimedical Santa. Order nutraceuticals. If you call us and tell us where you want it to go, or email us, and you order even a multi-pack, let's say a 3 or 6 pack, we'll send it to each of the people and even put a card inside saying that the gift was from you, to try to present them with basically the ultimate in wellness and health using advanced 7-star nutraceuticals. I just want to touch on some of the latest news that's going on. Of course, we have the statement by Josh Earnest from the White House, and we have the White House statements that I think is pretty obscene and not a proper transition of power from the American current president. That is pretty obscene. Then we, of course, have basically Sheriff Joe Arpaio has come up with a much more advanced analysis of the birth certificate, the first legal analysis of Barack Obama, and proved again it is a fake. The big surprise. So I guarantee you that there are a lot more fake stuff about the fake presidency of our fake president. So that's what's going on there. The Chinese warship seizes an American underwater drone. Actually, all it was a search drone for the bottom of the water. It was worth probably $150,000. The Chinese are just playing tit for tat in the South China Sea. When Trump gets in, things are going to start really rocking and rolling. The Chinese are better start behaving themselves and coming into line with reality, or they're going to pay not only in trade but also in military issues. So they're getting too big for their britches, and they're going to find out the hard way. Same as the Russians. I mean, they may have retooled their military, but they don't have the economy or the innovation to actually be able to do what we can do when we have a proper leader, a business person who will literally rearm America properly. And again, you do rearm not to go to war, but to prevent war. It's when you're weak that you get attacked. So that's really interesting. So those are the major stories that are going on right now. We've done this week an A to Z on all the nutraceuticals, and I find that incredibly useful. Now, I do have some new requests. One person requested that they get the wellness condition password. If you've not been a regular and a recent customer, you can't get it because you can only get it through Michelle. You can't pay for it. You can't, even if you're a health professional, get the wellness condition password. If you're a recent and a regular customer, you can make a request to Michelle, and then she can review it. So that's number one. Number two, people had concerns about live streaming videos, and they wanted to know how to get access. Well, beside the big picture on the front page of Nutrimedical.com, there's a link directly to YouTube, to live stream, and to Vimeo. And all the videos I posted live stream are also over at Vimeo. So Vimeo took them down. Live stream took them down. You'd have them over at Vimeo. A lot of them are live stream, but not all. I would say probably about maybe half or less are live stream. And if you sign up for live stream, we do a live conference or an interview, you can actually see it on your phone, computer, iPad, anywhere in the world, free. Now, we are going to have some pay-per-view conferences coming up in the new year, and those will be multimedia and high definition, etc. They're going to be great. And you'll be able to get all kinds of new information on health, geopolitical, spiritual issues, and so on. Those are all going to be coming. So we have actually full broadcasting capability now, and multi-site right from New York City, our main hub for live stream. And I have a custom-built supercomputer with all the media stuff now, so we're ready to rock and roll. So that's what's the latest there. Let's see what else we have here. They're looking for the Dead Sea minerals. Somebody was actually going to the front page. If you go to the right panel called basically the Nutrimedical affiliates, and just go down, you'll see it says MG12. MG12. If you go there, you're automatically going to save 5% by ordering through that link. So you're going to save right away. That's why all those links you're going to save, even like on Turtle Top Shelters, if you use that code for Turtle Top Shelters, if you use the code Nutrimed for your water system, you're going to save 10%. So there's a code for basically most of these affiliates where you're going to save some money by just going through our link, and that means that we will also get credit and a commission, a small commission for sending you over there for purchasing, because it supports our Nutrimedical report show. Let's have a little look here now. We have some other items of interest. Let's go to the main front page of Nutrimedical while we're waiting for our contact with either Matthew, my oldest son, or Ann Morrison. And I don't know if we have Ann yet. Okay, so far just voicemail. They probably didn't anticipate. Again, this is the Christmas season. Everybody's in an uproar, traveling, shopping. Their schedules are all thrown off. It's not surprising. guests, like, for example, Jonathan Gray. He's not available for the next few weeks because of the holidays, even though it's, I guess, summer down there in New Zealand, there's their version of summer, which, depending on if you're in the North or South Island, it can be either mild or pretty crazy weather, because it's a pretty big, long island. So let's have a look. Firstly, our current specials. I had one of our doctors actually listen to the program, and he was very used to using the Silver 100. And I want to respond to explain exactly what the technology is for NutriSilver. And now we've been working for years to develop a more advanced technology. All the other so-called pseudochemists and other people who don't know what they're talking about, like Len Horowitz talking about his oxysilver, these are all just inactive nanoparticles or colloidal particles of silver. They have no biological activity until they ionize. Now, when they ionize, which is a very tiny percentage, maybe 1/100th of 1%, they're active, but the thing is, if there are halides nearby, chloride, fluoride, or bromide, or protein amide groups, they're going to lock onto them and become inactive very quickly before they get to the target tissue. Silver 100 was really good, and was certainly much better than the previous products, but now we have a liposomally, enzymatically enveloped angstrom, that's atomic or molecular silver, that has been hydrogenated, so it's alkaline, so it'll go through the ion channels, and it's actively carried by these enzymatic liposomes. So this is far more powerful than even the Silver 100. There's no comparison. Then we have, of course, nutraceuticals like brain power, and believe it or not, there are some forces within the FDA, and of course some drug companies that want to see if they can quote, turn this into a drug. It's not. It's vinpocetine. It's a natural molecule. Very important for protecting the brain. We use it in just improving your memory if you're a student. We use it with our synaptin, with our Cognition Plus. We use it with things like CDP, choline, uridine monophosphate, and ultrathymine B1 to include cholinergic pathways, which, by the way, helps PTSD, whether it's a sexual assault when you're a child or a war combat. The areas of the brain that are regulated are cholinergic, and in fact, if you don't stop the non-motor seizure activity, there's actually a volumetric change they can see on deep brain imaging studies. So this is very brain protective. We have NutriDefense. I designed this to block all RNA and DNA viruses from attaching to the viral capsid, to destroy the viral capsid of all these RNA and DNA viruses, to block the Fenton reaction, which is a primary way that pathogens, including bacteria and viruses, and psittacosis enter tissues, and to boost the natural killer cell activity for fighting infections and or cancer. Power C Plus, and this is an amazing product. Power C Plus is extremely important. For example, cataracts, believe it or not, are a vitamin C deficiency, believe it or not. And so when you see someone developing a cataract or developing oxidized changes to their blood vessels, it's vitamin C deficiency. And we don't make vitamin C, humans don't. And as a result, we have a much higher need. If you take more than 500 milligrams of regular ascorbic acid, you're going to get diarrhea. But not with this, because it's the only neutral pH, not buffered, calcium, magnesium, sodium, potassium, ascorbate with bioperin in the world. So that's really amazing. Now, we have Life Support chocolate back on special. We had vanilla for a while. That's free shipping. 28.15 ounces. We have the QRMA and bioplasm and metapathy devices. These are all on time specials where you can purchase it. We not only have a sale price on them, but we also have you can have time payments. And all of the analysis for you and your immediate family of your QRMA are covered forever. So in other words, if you have a QRMA, your mom and pop and your kids and grandkids, they're all covered. If you have one of these machines, just send me your compressed file and a little history on the person. Now, if it looks like it's really involved and they have a very complex history and I need to review records, I will request a consultation, a time unit, usually 1 or 2 time units, depending on how complex the problem is. Green Tea Supreme. This helps boost your metabolism to burn off calories. It's on special. It also helps to pull out toxins out of your body. If you take Green Tea Supreme, it also gets rid of even bad breath, because the thiol compounds in your bad breath, it pulls right out of your body. Cardiovasc. This is essential for care of your vessels. Most people don't realize that hypertension and congestive heart failure and most vascular disease is failure of the vessels. Failure either to have a peristaltic spasm in response to the cardiac wave from the heart, failure to develop plaque, failure to cause spasm, which, by the way, most people don't realize that even heart attacks, half of the people that have heart attacks have clean arteries. So that gives you an idea. Now, I'm going to go through the Listen Live panel because a lot of people don't understand this, and the other panels on the front page of Nutrimedical. And by the way, also visit over, because I'll be posting a lot of news and videos over at clayandiron.com And also go over to visit the DEAGLE network. You're going to see a lot of audio and video links, and they're all searchable. So you can actually put a topic or issue like, let's say, hypertension or prostate or whatever, and it'll pull it up, or name of a particular, say, news person like George Soros. All the shows where those are discussed will pull up, and you can actually pull a clip out of it, whether it's 20 seconds or 5 minutes, and just it'll cut out, and you can actually email the clip to yourself or send it to anybody. So if you have something that you thought was important said on a particular program or good for you or for a friend with a particular health concern, because we've gone over the protocol, you can cut and clip out that audio, which is very useful, and just send that, say, 2 or 3 or 5 minutes to somebody, and it'll help them. And then they can contact me. And by the way, if they email me and they request help, it's free. It's only when we get into reviewing medical records I charge time. Firstly, the top panel, it says Listen Live. The first Listen Live button is just basically listen to the show on Showcast. That goes directly through Republic Broadcasting. Second is Nutrimedical Report Archives. That it brings you directly to the DEAGLE network, and it's all searchable. Live stream channel is the next one down. You can listen live to the show, too, on the internet on the next button, and the next one below that is live stream. You go to our live stream channel. If you sign up, anytime we're going to do a program, we'll send out a notice. You'll get it on your phone or your iPad or computer. Next is Zeno Live. If you dial this number after I posted it up, usually a couple of hours after the show, you can actually listen to the program on your phone. So you don't have to have a computer. You can listen to the last show, and it'll rebroadcast 8 times a day, 701-801-2263. The next is their Vimeo HD channel, and we have posted up now, I think, close to around 200 videos on YouTube and on Vimeo. So a lot of videos on everything from geopolitics to wellness to functional medicine to investigational editorial reports. Next is Nutrimedical nutraceutical formulas and protocols. Final Republic Broadcasting phone numbers. These are numbers to dial into the studio if you want to make a comment or question. We have some great people that called in recently, and especially yesterday, after discussions with Leo Zagami. 800-313-9443. And you can listen on your Android phone, and also with a non-Android, you can also listen to the phone apps. We have, of course, Nutrimedical products and technology videos and ebooks, YouTube channel, which is very extensive, and we have a huge following there now. You can purchase the Vimeo videos, and there's a pay-per-view area of Vimeo videos for documentaries, wellness conditions, and I'm going to put professional level teaching for health providers, doctors, specialists, chiropractors, naturopaths, etc., or people that want to know. You just pay for it. Anybody can pay for it. Vimeo video on demand, and of course the protocols for functional natural recovery. Those are all going to be hyperlinked directly there as well. So on the next right panel, it shows our link directly to our wellness protocol, nutraceutical supplements. If you go to the top panel, you'll see Dr. Bill Deagle, and shows my history. It shows news, a link directly to the news archives. Products, it lists all the different product suppliers, including Nutrimedical. Wellness conditions. Now, the only people that have the wellness condition passwords are those that are recent and regular and consistent customers that go through Michelle. And we change the password every so many months, a couple months or 6 months. The people that have that are our special core customers. Contact us. This gives you a contact page to email and home. Now, on the right-hand side, you'll see the second banner down, you'll see a bunch of what looks like vitamins, a stethoscope. It looks like some greens out of a little container. That is a direct link to actually contact me. The next is Carrot Bar's Gold Back Saving by Gold business, and below it is how to join. Then we have Michelle's Nutrimedical forum, and if you want to post something, you contact Michelle, and we'll post it over at the forum at our over at our DEAGLE network under Blueberry. So that's an ability for you to also contact other people in your area of the country or the world, is to contact through Michelle, and she'll post it up there. The next is 10% off code for Pure Water Systems, the BEV system. These are amazing. The next code down, you'll see a picture of Nebuchadnezzar. That's the proper way to pronounce it, which means King of Kings, which is a blasphemy against God. ClayandIron.com, CLAYANDIRON.com. All of the news items above government technology, spiritual issues is all over there. Jurisdictionary, how to win in court. And we'll usually once a month at least have Dr. Fred Graves on. This is an essential course. If you're an American and want liberty, you have to protect our liberty with the court systems. it's better to go to the witness box than the cartridge box. Next is Summit to C, 1.3 atmosphere hyperbaric chambers. If you have a serious health condition or if you're an athlete and want to maintain performance, this is essential, and it's very doable, very affordable. And you can do it with a health savings account, with a lease, and with a purchase, and these are considerably better priced than the other companies and far superior technology. No comparison. Now, my friend Jim Corsi in New York City operates a mobile service for both QRMA and bioplasma metapathia. He can do a QRMA test on you, and he's mobile, so it'll come within an hour of New York City to actually help you. He's the only site right now that has the advanced training to do the metapathia scans. When I get a scan, I prefer to schedule it in such a way that I can actually log on to TeamViewer 11 and do a video capture of the entire scan of that person's harmonic resonance using this Russian technology of the metapathia. I then have to have it combined with their wellness medical history and records. It's a full consult. It's not just like a quick and dirty test that gives you a few blood work. It's a full consultation, so that's really important. Now, the QRMA is really quick. It takes a minute. The full scan for the metapathia can take 3/4 of an hour or half an hour, depending on how complex, because it scans down to individual cells, tissues, and even specific chromosomes and DNA. So it's pretty amazing. VibraSlim. This is the best vibrational exercise you can get. Fantastic, and it can be delivered before Christmas. We have warehouses around the world, so they're not just available in America. In America, there's no cost for delivery, and 3-year warranty, and all parts of it's modular. Less CMFs, this, of course, is the best place for electrosmog and radiation. Also supplies equipment to convert our MP3s, which are expanding our list. I had a recent request to add vision and eye care frequencies for the specific resonant frequencies of the enzymes that we're trying to induce by getting the minerals into the cells. That and many other frequencies will be popping up under that MP3 area under products. Then there's a link directly to my oldest son's website, MatthewDeagle.com. We've been doing a lot of shows recently on the genetics and what's called forensic psychology and forensic psychiatry of violent behavior, talking about the monoamine oxidase genes and the genes related to tryptophan and serotonin metabolism. These should be part of ultra-vetting, by the way, by the Donald Trump administration, and I'll be getting off material through some of my proxies that actually know Donald directly. So then you have MG12, remember that request, Dead Sea Minerals, cosmetics, etc. Dave and Jean Mitchell, if you want to get a prepper organization or buy and sell a home anywhere in America or set up a special reserve place here in the United States or around the world, they're the expert people to contact. Prepare. And welcome back to the Nutrimedical Report. One of the areas I'd like to cover is some of the advanced, what I call, issues that people present, whether it's deteriorating hearing because of high noise exposure, deteriorating vision. There's a lot of research going on stem cells. In fact, I've got some articles that are quite interesting. I've been following the news regarding that. Just giving scientists are reversing aging in mammals and predict human trials within 10 years, of course. We already have a lot of nutraceuticals that will extend aging. In fact, I'll give you just the top 3 right now. The first one is you want to take anti-age max, which is, by the way, age-less, because it has not only the sulforaphane glycosinolate to repair DNA, but also has the age-less to lengthen your telomeres. Number 2, cell detox glutathione, because glutathione is very protective of mitochondria, and most aging ties directly to mitochondrial function. In fact, one of the sine qua nons of diabetes, if you look at an electron microscope, is decrease what's called mitophagy, which means old damaged mitochondria hanging around. So if you have nice, healthy-looking mitochondria with crystal galli on the scanning electron microscopy, you're probably healthier, and there's metabolic tests you can do now for it in advanced labs. The third that I recommend is to take a catechin. For example, such as our NutriDefense that has the anhydrous catechin is the most powerful antioxidant we have. And then the fourth that I would recommend is Mountain Red Velvet. Mountain Red Velvet supplies the 396 biomolecules, 6 growth hormones. Then we have microdose, which is actual HGH, human growth hormone. So it's not just a growth hormone releaser, it is growth hormone. And it's a nanoparticle dosage, so it's going to help your brain release it. So those are just a few of the nutraceuticals. We also have peptides that can actually regenerate your tissues. We have, of course, hyperbaric oxygen, and we have, of course, a scalar, I call morphogenic field therapy, where we have lumen photon micro pulse, which helps to stimulate your stem cells 400% and can help to heal and turn off inflammation. We have the matrix pulse, which is a sister machine just recently released, with Dr. Ross and Dr. Dennis put this together, and this machine actually will turn off pain. And we want small and portable machines rather than big clunky ones that are also affordable. The micropulse, if you use our code, is under, I think, $400. The Matrix Pulse is under $500. If you use our code, you save additional $30. So the technology is moving forward, even these so-called hard science, and they found these specific enzyme breakthroughs that actually will turn cells back into their more stem cell or fetal type presentation. So the genetics is already there, and we have nutraceuticals that will actually do a lot of the age reversal technology to your cells and protect your DNA. We have, of course, the ellagic acid from the terminella chibulia plant, 300 times higher concentration than the pomegranate, which is sacred in ancient Israel because it repairs DNA. It's at the capitals of all the ancient Israeli buildings of Israel, and the reason for it is it's one of the most powerful molecules from the pomegranate that actually repairs DNA. So that and our sulforaphane glycosylate from broccoli seed extract are two major DNA repair formulas. And they also were used for cancer cell prevention. Now, if you look at our other research on this, we have, of course, anti-aging breakthroughs in terms of DHEA and pregnenolone to turn off the inflammation of the skin, and curcumin that not only repair the DNA in the skin from sun damage, but also reverse the toxic transformation that occurs in the skin that occurs when chemicals that go through your bloodstream are activated by solar and the ultraviolet light activity. Most people aren't aware that ultraviolet activation of biomolecules in your skin and activation of pharmaceutical chemicals can be a problem. And the medical profession has not addressed this by looking at people's exposure now to ultraviolet light can actually activate specific drugs. That's why certain drugs like, for example, Levaquin and moxifloxacin are a DNA gyrase 4 inhibitor. If you get exposed to sun, it increases the danger that it can cause weakening of your ligaments in your body, so you can rupture an Achilles tendon. It also weakens the ligaments that hold your iris and your lens in your eye, so you can get a lens dislocation. It can affect the connective tissue around your aorta, so you can have a dissecting aneurysm or aortic expansion. So there's lots of things that people don't realize that DNA gyrase 4 also inhibits and damages mitochondria, so that you can get what we call a drug-induced mitochondriopathy caused by solar. And welcome back to the Nutrimedical Report. Recently I get people that send me all kinds of things, including even pictures of their skin lesions, and one was sent actually for a person regarding their relative. And they had a vesicular rash, and of course the most common vesicular rash is a herpetic rash, herpes simplex or similar viruses. You want to use an antiviral. Nutrisilver and Nutridyne are topically applied 4 times a day, usually separated by at least 10 minutes. And then apply anti-inflammatories, DHEA, pregnenolone, and curcumin cream, and that 4 times a day, that should make it disappear. So that works very, very well. And the virus will disappear if you take it orally, because a lot of times there's an internal virus and it's bubbling up to the skin. Post-traumatic stress disorder. This is interesting. I had a lady who underwent some very serious sexual abuse as a child and young person. PTSD can occur with military operations or sexual abuse. The first thing you want to do is you want to protect the brain from the oxidative stress of seizure activity in the amygdala, the rage control nucleus, and the areas of the brain that are called the limbic system. So Brain Mag and Calm Mind, a scoop 4 times a day. Cognition Plus, 2 capsules twice a day. Brain Powder, a capsule twice a day. And Neurogen for remyelination, because you actually do volumetric studies in people that had a post-traumatic event. You can actually see volumetric changes to the brain because of atrophy. So Neurogen is going to help to prevent that by keeping myelination. We want to support what's called cholinergic pathways, because the cholinergic pathways are protective and actually maintain function of the limbic system and balance. They also maintain areas of the other parts of the brain, like the hippocampus, for memory. So you want to use ultrathiamine B1, 2 capsules twice a day, at least 3 times a day. CDP choline twice a day, at least 3 times a day, which is cytidine choline. Uridine for people that are what's called thought to be slow accelerators, or and uridine monophosphate. Posidol, this is a new upgraded formula for maintaining the mood, is very effective. And of course the Posidol formula is good for depression, hypertension, and rebalancing the autonomic nervous system. CoQ10 Supreme Ubiquinol. You want the water-soluble form because it crosses the blood-brain barrier and to stop free radicals gamma E+, 2 soft gels twice a day, and cell detox glutathione to produce hydroperoxy, nitroperoxy radical, and BioLVR because B12, folic acid, and activated B6 is very important for brain neurotransmitter function. I recommend transcranial lumen photon therapy with the light at setting number 7 for inflammation of the brain and setting 3 for stimulation healing, transcranially at the temples, at least a half hour of each of those settings twice a day. And you can also use transcranial micro pulse therapy to try to stimulate the brain, to help stimulate healing. It's very effective. EMDR, this is where you go referral to a PhD psychologist for eye movement desensitization therapy. It's one of the other therapies I find very helpful. And for PTSD, mild hyperbaric oxygen therapy combined with ozone is extremely important to oxygenate the areas of the brain that are under excessive stress and seizure activity post-trauma, because there's a non-motor seizure activity occurring. And if you do deep brain studies, you can actually see evidence of that. So it's a non-motor area of the brain, so you're not seeing somebody seizure or fall to the ground, but the areas of the brain are constantly seizuring. Interesting, eh? So let's see. We have also so I get some really interesting questions. Reflex sympathetic dystrophy. This is a form of pain syndrome where, and this ties back to my theory about pain, which I'm going to produce a series of videos that'll be up on live stream, Vimeo, and YouTube. My research on pain, which goes back almost 40 years, goes back to my research in medical school in the 70s with Dr. John Woodbury, discovered some very important principles. The first principle is, number one, even if you have an autoantibody, let's say you've got T lymphocytes and you've got rheumatoid nodules and you have a positive rheumatoid factor for rheumatoid arthritis and it's attacking a particular type of collagen, it's triggered off by Mycoplasma hominis incognita, a particular type of mycoplasma. But the primary problem isn't the antibody or even the presence of the mycoplasma, which you need to eliminate, but it's the problem with the autonomic nervous system. Without the autonomic nervous system and electrical circuit there, you can't stop it. So topically, you want to apply DHEA, pregnenolone, curcumin to the skin over the area of the RSD because it's primarily a skin and autonomic problem. Secondly, you want to calm down the brain because there's actual excessive activity of the non-motor, what's called the autonomic nuclei along the paraspinal areas of the body that are retroperitoneal. So calm on the brain wave doesn't work just on the physical brain, it works also on the autonomic brain inside your internal organs. And the celiac plexus. Cell Defense Plus, this is curcumin, which has some very major effects. It's the most important new breakthrough in terms of curcumin technology in the world. And nutraceuticals are Cell Defense Plus. And this will alter, not only get rid of the stem cell cancer cells, but also readjust your DNA and your cytokine levels to turn off the signaling that actually activates disease. So curcumin at pretty good dosages, at least 2 capsules 3 times a day. Posinol, this helps to rebalance your autonomic nervous system and mood elevation. Brain power, vinpocetine we talked about before, helps to protect against the oxidative stress that occurs in our RSD. Ultrasimon B1, CDP choline, uridine monophosphate. And for myelination, because often there's peripheral dysmyelination of the Schwann cell sheath that occurs as well because of the abnormal metabolism, and peroxynitrate radical, is cell detox glutathione, and the Omega Supreme Krill in our new Omega, which is coming out probably in the next week or so, is the Omega Supreme Pro. And this is a monoglyceride form which increases absorption from 300 to 400%. It is amazing. So remember, if just adding an omega fatty acid, which are super high quality, but our new monoglyceride technology is completely unique. Nobody else in the world has it. So if you want to cut heart disease, vascular disease, and protect your blood vessels, you want the monoglyceride forms. We're also adding a little Amazon store, which will have some other, not only nutraceuticals that we don't carry, but also mainly technology, things like the HydroFloss. I'm hoping that that'll be activated by Monday. Apparently that's the date that they've given me that it should be activated. Hopefully that's all finalized. Amazon's kind of picky, and some of the people they use are slow to kind of respond, but they're a big organization. Protocol for dental infection. Again, I recommend that when people have dental infections, number one, you get a pan x-ray to make sure you don't have a periapical abscess, and it will eventually erode away at the bone and break the Sharpay fibers. It's important to understand what's going on when you have a dental infection. Let's see. This particular person, I recommend, of course, silver The NutriSilver, held in your mouth for 10 minutes. You can brush your teeth with it firstly before you use the adjacent toothpaste, which has things that will actually help to get rid of dental-bacteria. Then, of course, you want to use CoQ10 ubiquinol to heal the gums and the tissues. And I usually recommend that, after you rinse your mouth and you swallow with the Silver 100, one spray per 10 pounds body weight. The NutriSilver is far more powerful than even the Silver 100. This will help to clear the infection there. You can also add another antipathogenic Nutrodine, 15 drops, usually 3 times a day, and Allicin Med, a capsule 3 times a day. And the settings, called the NICO setting on the lumen, is specifically designed to heal periodontal disease and cavitations, and what's called NICA, which is periodontal and membranous bone inflammation and osteomyelitis in people that have bad teeth. Basically, their teeth are rattling around their head. So you don't need to suffer. We can assist your dentist. And if the dentist, we have organic dentists that we've advised, and if they use our protocol, it improves the survival of people's teeth, and they do much better with even implants. I had a recent request by someone who wanted to know about drugs, and of course, all I do is provide information. I don't recommend drugs, and this gentleman was having some problems because he couldn't afford the Trulicity, which is $750 a month, but his insurance would cover a drug called Bidurion. Now, what I did is I sent him back the information on Bidurion, and you need to understand it'll lower your blood sugar all right, but there's some real serious risks. And you need to know it's not insulin, but it has an effect on your insulin sensitivity, so you can get problems, including things like renal failure, etc. Then I gave him an article called Diabetes Medication Isn't Working, So What Does? And there's 2 pages of this article. I'll be posting it up on Nutrimedical and doing a video on it because I think it's that important. Roughly 10% of Americans are overt diabetics, but if you actually look at the study from the University of California, Los Angeles, on Californians, they estimate that of adults in California, which is an example of the whole country, 69% are either diabetic or borderline diabetic by criteria. And that's just their diabetic criteria. Mine are more strict, which includes, are you hyperinsulinemic? Do you have increased free radicals? Have you got oxidative stress? Do you have nutrient deficiencies in your cells, which we can scan with the QRMA or a PAC red cell test to look for the decrease in antioxidant activity of superoxide dismutase, glutathione peroxidase. Because ultimately, what the studies have shown is that even diabetic treatment of blood sugar does not prevent most of the major causes of death. In fact, some of them, they increase. The diabetic drugs, for example, actually increase the rate of heart failure by 47%. That's an actual published meta-studies that they have. So I'll be doing a nice little video on that, and that'll be posted up and linked up on our wellness thing. You'll see a little green banner there on Nutrimedical, so you can actually look at the articles yourself. And if you want to read the original literature, the links are there. So you say, well, I'm skeptical. I don't know. This is a conspiracy. No, it's not. It's published literature. And it's in the regular mainstream medical news, by the way. Plus also news from the American Journal of Clinical Nutrition and other major things like, Journal of Trace Elementary Medicine, Journal of American Medical Association, American Journal of Clinical Nutrition, etc. This is not like often la-la land. This is real stuff, and it's serious when academics are saying, well, why aren't we solving the problem? If we control blood sugar, how come we're not stopping these events? It's because they don't understand the problem. Just like when I did my original research in diabetes and proved that diabetics have high insulin, diabetics have basically very little antioxidant capacity. So the real primary problem with blood vessel failure and congestive heart failure and hypertension is not that the heart's failing. The heart's trying to compensate for the blood vessels failing. And the blood vessels fail because they lose superoxide dismutase 1 and 2 isoenzymes. They lose the ability to generate and respond to nitric oxide, which is why we've added another nutraceutical as a substrate for our supernox and cardiovasc to increase nitric oxide metabolism in your blood vessels. So, the regular medical profession should stop fighting this and realize that there's an interaction between some of a minimum amount of drugs and nutraceuticals. It's positive, but many of the drugs that are given actually cause new problems or don't address the issues or don't change the ultimate outcome or actually increase the risk of long-term complications, whether it's renal failure, like the Bidurion, or other issues. So you need to be aware of that. That's in the published literature. It's not made up by Dr. DEAGLE. You can read it yourself. Once in a while I have someone who would request me to contact somebody else completely out of the blue. That never happens. stop sending those requests. And then one gentleman sent me a note. His first name is, he calls himself Cowboy. He said, well, Cowboy, have that person that wants help, just contact me. I'll help anybody. I don't care where they are in the world. They could be in any country, in any state. They could be a homeless person or a prince. Doesn't matter. I'll help them. Just have them contact me directly. But I don't pursue people. There's several things I don't do. Number one, I don't recommend drugs, but I'll provide you information so you and your doctors can decide. But I will recommend nutraceuticals. I will recommend specific types of specialists or treatments you'll need, whether it's conventional surgery, like I did a few weeks ago. A gentleman had problems, and I said, well, you should have had proper retinal laser surgery, but they didn't. They actually put in bubbles into his eye and wrecked his vision. So, I'm aware of these specialists. I'm a certified expert medical legally in every specialty. So if I don't know, I'll research and come up with answers and tell you what the truth is and the latest state of the art in terms of conventional advanced medicine, chiropractic, herbology, whatever. So it doesn't matter. Dr. DEAGLE will conquer them all. And I do that for your sake. Let's see. I often get people that think they need to have a big, long thing. No, just send me a paragraph with what your wellness and medical challenges are, and maybe what meds you're on, and what treatments you've taken or nutraceuticals you're taking, and I'll just give you a list of nutraceuticals to start and regular conventional tests or advanced functional medicine tests you can do. So that's all free. You just have to email me. Let's see. Sometimes the people will be very concerned, and I get sometimes a ton of emails. Is that okay? I have clinics around the world too. One I kind of be sites. I have one here in Australia that just contacted me. I said, look, just start off with a QRMA. Get a time payment. Start charging your client, customer, patients a fee for doing the tests and collecting the data, collecting their history form. It is always a consult if they get a outside. So I need a wellness history, and I usually need 2 units at a time purchased for a full QRMA analysis so I can match it against their medical records and their history, and then come up with recommendations, which may be conventional, surgery, medical care, and I do not recommend drugs, but I will recommend certain kinds of specialists or treatments. Chiropractic, naturopathy, deep tissue massage, whatever it is, force plate analysis with a podiatrist. A lot of time people are not aware that there's biomechanical issues that need to be addressed. So you don't just adjust the biophysical, you need to address the biomechanical and other issues too. One of the things that I saw recently on the news was childhood cancers. Almost all childhood cancers, by the way, are called rest cell tumors. Rest cell tumors mean they're genetically abnormal. And to be honest with you, we could use fluorodeoxyglucose radiolabel antibodies against specific gene complexes and do a positron emission tomography scan even on a child where we suspected something might be wrong, and it'll pick up all the sites. We could also start doing technology to actually alter the genetic of those cells using specific targeted chaperone molecules that could go in and actually change the genetics. These children are identified early because we have gene markers of cancer. They're universal gene markers of cancer. Could be tested in all children, and if they show positive, we should start giving them gene therapy with our nutraceuticals, simply lactic acid, their sulforaphane glycosylate, malignant block, etc. These can check, and you can recheck the markers to see if the cancer cell markers are normalizing. And we can do off-label use of drugs called gene-based cancer treatment, like Dr. Brzezinski and Dr. Eisels in the Eisels Clinic in Santa Barbara, California, and a clinic that I've used for almost 30 years now in Germany, where it does off-label use of drugs to actually switch the genetics of the cancer back. Because you can identify the cells in the blood, or if you have a biopsy of the tumor, if you do it in the blood, you'll always see that there's cancer cells floating around. And by the way, anybody who survives cancer always hits cancer mother cells in their blood, and it's easy to test to see if those cancer mother cells are present. The only nutraceutical I know that actually gets rid of them is curcumin, which is why it's so amazing, our new formula. You can actually get rid of your cancer mother cells if you take curcumin, our Cell Defense Plus, which, by the way, is one of the most non-absorbable nutraceuticals, but one of the most important on the planet, probably the most important, but we have the only technology that will make it a super absorb. So that's very neat. So people want to restore collagen. I had one gentleman ask a question about collagen for their friend that went vegan. Collagen Max and Nutrimedical for Majesty's Royal Jelly. You're going to generate pro collagen with the Royal Jelly and the Collagen Max, and boom, you're better. And then, of course, by the way, you also want to take our Minerals Plus and Vitamineral Max, because without the trace minerals, you're not going to generate the proper healing process. You need zinc and copper and the antioxidant. We're going to talk with Ann, of course, about a number of issues, and we regularly talk about things that are above government technology. Some of these issues and science is actually posted over at clayandiron.com. A lot of it you'll see, the audio links and so on are up on Nutrimedical on our DEAGLE network. The Clay and Iron site includes a lot of issues. For example, I have reports going back to 9/11 with the Finnish munitions expert that gave me a 35-plus page roughly document PDF that he was contracted by the Port Authority of New York. You'll see lots of other information there that's very valuable. A lot of information to actually, cross-index the Bible and what's been said there in terms of what's going on with current events. And just to summarize right now, I am so pleased with Donald Trump and Mike Pence as presidents. It's amazing. And what I want people to understand is that we have a situation now where America is now in a state of what I call true repentance. We avoided the horror of literally card-carrying witch who was involved with John Podesta with these evil things of pedophilia, to a man who his strong family who's pro-life now. I mean, he wasn't in the past, but I can tell you the transition to pro-life isn't always easy. And we have a situation where we're very likely to see the passage of things to get rid of Roe versus Wade, to rebuild our economy, to control and get rid of violence in our streets, and so the inner city black young men and Hispanics and so in the inner city will have jobs. They'll be able to get an education. Families will be able to go safely to the store or the theater. I'm really looking forward to the change in America. Now, there'll be a lot of opposition. You can see it right now. It's really disgusting to see the current president, Obama, who's a phony, with his phony family, literally making misstatements to say the Russians hacked. And even if they did hack, they hacked the truth about what Hillary Clinton's all about in her server and her foundation and everything else. She was taking money from people like the Saudi Arabians and Qataris that actually support ISIS and will, kill basically gays and lesbians and kill people that are alternative sexual orientation, before Friday morning prayers. Now, I don't support the alternative viewpoints, but I can tell you all Americans, no matter what their situation is, deserve to live and prosper in America. And Donald Trump said that. In fact, Twitter and Facebook actually made attacks against Donald Trump, saying, they were trying to prevent his people that were, basically joining the Trumpian party that were gay, lesbian, or transsexual. And that's really bizarre. It's like, you guys want to put this guy out as a misogynist and a hater and, like a closet Ku Klux Klan. And in fact, everything about him is the exact opposite, which I find, not only I've seen, it's like, and I've talked to people. Even yesterday I talked to a lady who said, well, what about this? Is he really a Christian? Yeah, he's not an advanced Christian. He's a baby Christian, which is why he needs lots of prayer. He needs advice. He needs all the people around him that are godly, I think what we have to realize is that this is our responsibility to keep him on track with prayer and advice, not to let him go crazy or to let other people haul him away and do things that are not godly. We will be back in a moment with Dan Morrison. Coming up in hour 3, our wellness protocols with Michelle, the host with the most, with her humor, her questions you bring to her by phone, 888-212-8871 through our order line, or by email. We're here for you. We pray for you.